All right, so we are going to do a fun episode called a little game show called CIRS, Fact or Fiction.
Ooh.
Fact or Fiction.
Is that like truth or dare?
Fiction. A little bit.
Okay. Yeah. I'm going to go with dare.
Yeah. Oh, dare is much better than the truth when
Dare
it
is
comes to
always
this
better.
illness. Yeah. You can't handle the truth.
You're right.
I think Al Gore stole our movie title, An Inconvenient Truth. That's freaking CIRS. Yeah. So, brother, I'm going to ask you questions, and you're going to say fact or fiction and riff on your answer.
Riff on.
You can diagnose CIRS with urinary mycotoxins.
Fact. Not. Oh, dare. No.
Do not say something that someone could edit.
There are a number of peer-reviewed and published ways that you can make the diagnosis of CIRS. And interestingly enough, every one of them requires both subjective and objective testing measures to be abnormal. But urinary mycotoxins is not one in any of those diagnostic methods. In fact, the best you can get from a urinary mycotoxin test is that there was an exposure that's documented, but
to something. Eating a Planters peanut with Jimmy Carter, or
aflatoxin number one.
Eating a moldy blueberry,
absolutely,
or being in a moldy building.
Right. The question that I look at when I'm looking at a urinary mycotoxin testing is how many of the toxins are positive and how high are they? How many multiples of the normal range? And if I'm seeing that there are a number that are elevated and they're elevated quite a bit, to me that's much more likely to be from inhalation than it is from ingestion.
And I can get behind that. And my question that no one has asked or evaluated yet is, and that could be a normal, healthy response, right? I could be in a super moldy dorm and my body is appropriately eliminating urinary mycotoxins.
Fact.
And I am just feeling good, but my girlfriend feels horrible.
Right.
And she has the exact same level of urinary mycotoxins. So fact or fiction, two spouses can live in the same water damage building home and one feels fine and the other doesn't.
Yeah, particularly if they're in separate bedrooms. Fact,
yeah.
Right. And, another part of that mycotoxin question is, it would be much more helpful if there were some published norms, where they've actually taken healthy people and evaluated, how much aflatoxin or MPA, mycophenolic acid, how much of those were actually in the urine of healthy people. And then it would also be helpful if we gave them some moldy bread or something to eat and got some sense of how that affects the urinary mycotoxin amount. Unfortunately, I don't know of any studies like that have actually looked at those things.
I would love for them to do that work. And the way we explain it to patients is what Dr. Shoemaker did is he took approximately 500 healthy people and 450 and took their inflammatory markers, because inflammation is a normal part of health. You need inflammation to do neuroendocrine immune stuff. It just goes out of control and then causes illness. But he had the blood of 450 plus people who were healthy. And on the clustered symptoms, those 37 symptoms that we ask in 13 groupings, those healthy people said yes to 3 symptoms on average.
2.9.
2.9. That defined healthy.
Yeah.
And on there is fatigue. On there is tingling. You could have a herniated disc and have tingling.
Exactly.
But of the biotoxin ill, 30% of that group, at least 30% said yes to one of those symptoms. And that's how he came up with the 37, right?
Yes. And on average, people that had CIRS had like 21 or more symptoms.
Yes. Yeah, and if it was 19 and under, I think it was right around 20, 21. And then if it was older, it was more like 25, 26. And we see people with 35 out of 37 symptoms. So I can screen with the clustered symptoms, but I can't confirm diagnosis.
Right.
I need my Shoemaker labs.
You need the labs.
You need the labs. So what urinary mycotoxins have not done for our listeners is they have not separated healthy people from sick patient. When you are told you have breast cancer, you have a tumor on a 3D digital mammogram that is different than a woman with clean breast tissue. There's a difference.
Or a fibrocyst.
Or a fibrocyst. But there is a difference between the healthy control versus the sick patient. And that is the same for the CIRS, Dr. Shoemaker biomarkers. No one has done urinary mycotoxin separation between healthy people and sick people.
Well, and that's what defines a biomarker.
And that's what defines a diagnostic biomarker.
Yes.
And that's where Dr. Shoemaker, when he's talking really fast and you're trying to keep up, he says, they haven't separated sick patient from healthy control. And what he's saying is healthy people have the same level of urinary mycotoxins as sick patient. And if the healthy person has the same level of something as the sick person, it doesn't help you separate out. Could it be water damaged buildings? Could it be low vitamin D? Could it be breast cancer, right? You need a validated lab or image to say, these are the healthy people, these are the people who are suffering the illness.
Absolutely.
Yeah. So that's, I do say there's two, there is one good thing about urinary mycotoxin testing. It brings up awareness.
Oh, I thought you were going to say it tastes good.
Well, moldy blueberry is not my jam, but what I've found is it does bring up the awareness, and sometimes they'll find your clinic or our clinic or Pectatulio or whoever the flavor of the day is. Unfortunately, they spent a lot of time, money, and energy to get there.
I see within the mold world that there's another camp that diagnoses differently, they treat differently. I don't believe they get the same results that we do, but I can't compare them because they don't publish either.
Right.
And I am thankful that they have increased awareness, but I'm also discouraged because I don't think that they deliver optimal treatment, and they definitely don't diagnose in the correct ways, in the peer-reviewed published ways, which actually puts those providers at risk. If their state board their licensing board should look at what they're doing, they don't really have a peer-reviewed published way of defending what they're doing. And so I think it's dangerous for them. I think it's bad for the patients.
Well, and I couldn't agree more. And I tell patients all the time, we don't have a Republican or a Democrat problem. We have an integrity problem. And whether you took the Hippocratic Oath or you took the naturopathic oath, I remember taking that oath, and it was pledging my life to protect the patient's time, money, and energy is how I embrace it, to do everything in my power to make the best decisions to get this person graduated back to a productive, creative quality of life. And when you filter some of the junk science that's going on in the world of mold, in the world of chronic inflammatory illnesses, it just doesn't stand up. And what I think is happening is what I call the functional medicine hook. And the functional medicine hook is where glutathione is a novel anti-inflammatory, right? Turmeric is a novel anti-inflammatory. If I Wim Hof breathe, I will dampen inflammation. Those are great modalities, and they have their time and place. But fact or fiction, does glutathione bind biotoxin?
Fiction.
Fiction. Yeah. And that's, can I use activated charcoal and Welchol interchangeably, fact or fiction?
Interchangeably?
Yes.
Fiction.
Fiction.
Yeah.
Are there any data that show bentonite clay lowers complement 4A, TGF-beta, or MMP9 inflammatory cytokines?
Dare. Now, not that I've seen. Yeah. I haven't seen any studies. And again, that's the problem is this other group, which is perhaps even larger than the group that you and I are involved in, has spread awareness, which is great.
Yep.
And they do an excellent job of marketing. What they haven't done is a good job of publishing. And if our goal is to get every doctor, whether they're naturopathic or chiropractic or whatnot, to know about this illness so they treat it early on, then I don't think it's beneficial to include it to not publish. You have to publish.
Absolutely. And I think for me, and I know you're the peacekeeper in a lot of academic circles, and we're on the same team about this. Fact. It is, for me, fact. It is not an us and them thing. Right. It's not like I'm right and you guys are a bunch of dodo brains. It's about the chronically ill patient. I filter everything we do at Roots and Branches, every single decision we make for the patient of what's going to graduate the likelihood of them overcoming this illness. And I wouldn't touch CIRS or mold illness with a 10-foot pole if it wasn't for the work of Dr. Ritchie Shoemaker. And what I think is wild is you're going to tell someone they need a $40,000 mitigation, remediation, redo of their crawl space, and you better be sure. Yeah. And what Dr. Shoemaker's peer-reviewed, reproducible, published work did is it allowed me to go, this is what needs to happen. I have documented it. I have validated it. I could stand in the court of law and defend exactly why we're doing what we're doing. We didn't cut corners. We didn't bait and switch medicines. We didn't do anything that wasn't peer-reviewed, reproducible, and published. And the beautiful part of that is it has never failed. And people go, wait, the Shoemaker protocol has never failed? And I say, no, it has never failed. We are over 1,000 patients in. It has never failed. And they say, never? I say, no. Now hear me. That doesn't mean people aren't stuck on step one. Even if you spent $5 million, if the building isn't fixed, it's not fixed. And that's where evaluating that problem, like we were talking on a previous pod, we need a doctor, a health coach, a trained inspector for CIRS level evaluation, a trained remediator for CIRS level clean, and a engaged patient who really wants to learn this illness. They don't have to go on CIRS marches and do all that stuff. They just need to understand this illness enough so that they can be empowered, not panicked, and spend time, money, and energy wisely, because these are not endless resources. And for a lot of people, the finances are the toughest. So when they come in, $75,000, $300,000, the biggest we have is a $5.5 million wasted money patient.
Wow.
And that was a big tech mogul, and most of that money was about $500,000 was doctoring and IV glutathione and IV ozones and all these treatments that are not substantiated. I'm not saying they don't have any place in medicine. They do not treat CIRS. And he was panic buying houses. That was the biggest thing. So if he would have started with a Mike Schranz or a Bill Weber or Larry Schwartz or a Greg Weatherman or John Banta or Cindy Edwards, you know, God bless, having some female organized, honest sequencing energy on how to do an inspection, he would have bought one house and he would have bought the right one.
Yeah.
Right. But he had enough money to be stupid frivolous on panic buying houses. And it actually traumatized the family because this one failed and that one failed and that one failed and that one failed. So fact or fiction, IV ozone treats CIRS.
Ooh, IV ozone. I have an IV ozone story, but I won't bore you with it today. Okay, I will. By the way, it's fiction. I was once watching, I had some friends who wanted me to watch this video series of it wasn't a naturopath. It was probably more of like he was an MD who got tired, MD. Who became an integrative MD and was doing things. And he was talking about all these natural things that he was doing. And so I'm on part 8 now, and he's doing IV ozone. And it's like, what is natural about IV ozone? You know, taking somebody's blood out, mixing in some ozone and putting it back. It's like, I didn't watch any more after that. Sorry, not natural.
Yeah. And that doesn't mean there is some good publications on ozone as an antimicrobial, and I'm not saying it doesn't have an application in medicine, just like activated charcoal can be used by poison control for binding certain chemicals, right? Not nature toxins.
Right. Well, and ozone can have a place in in CIRS, but it's a very small niche. And the only place that I use it is in patients that are having problems with multiple chemical sensitivities if they have to move into a new place. And so if this place has been built in the last 6 months, 2 years, something like that, there's often still a lot of off-gassing. And I'll suggest that they have somebody ozone in the house before they go in. But it's not to kill mold. Okay? Because the dead mold is just as bad for them as the live mold is. It's to coagulate some of those VOCs that are floating around. Because I've had my own success with ozoning, like after painting filing cabinets and ozoning, and the VOCs were gone the next day.
But wouldn't you, the key to that, because I don't want listeners to get confused, is you said new house. Because we know, and you were the one who really burned this into my synapses, if I throw an ozone bomb in there, or I throw an anti-microbial fog, right? I put some thymol into the air, right? If something works to kill microbes, and you can't have it both ways. If you're killing microbes, you're killing microbes. If you're claiming that you kill them and you show that you kill them, great, you kill them. But then you take that cell, and I tell patients, draw a circle in your mind's eye, and you rupture it.
Yeah.
And now you take that circle and make it into dashes.
Yeah.
And those dashes are called cell wall fragments. And they are dectins, mannins, beta-glucans, as we've been talking with Dr. Shoemaker, mycotoxins. And those cell wall fragments are hundreds of times more stimulating to the immune system than having left the intact spore.
Absolutely. And they get deeper into the lung when you inhale them. And there's roughly 514 of them for every mold spore that you find. Yeah. So I'm not a big fan of ozoning a house to kill mold. Or UV lighting to kill mold, or anything to, like you said, using antibacterials or antimicrobials to kill mold. You have to get the mold physically out of the breathing space. But to get rid of VOCs, that's a time. But that's one little niche that I use.
And I'll just say my preference for that, and we again don't have financial relationships where they've done some very cool things for some of our indigent patient population, but the AeroAsis iAdapt machine also pulls VOCs without ozone byproduct. And the reason I'm so sensitive to that is we had a patient with lung injury from ozone. And we didn't recommend the ozone, but for some people that can be, and anytime you use any kind of fogging or whatever, you have to realize that you have to double HEPA vacuum and microfiber damp wipe down everything to pick up what Jenny Johnson calls the dead crumbs. And I love that saying, the dead crumbs, which is really just the cell wall fragments that you were suggesting.
So fact or fiction?
Yeah.
Dry fogging is just as effective as wet fogging.
Wouldn't we like to know the answer to that? We would say it is fiction until someone proves it as fact.
Yeah.
Right?
Yeah.
So there's a lot of these products on the market that are dry fogging, and it comes out as a moist fog, and then it just kind of evaporates. And people have big claims on websites about what these do. Where what Dr. McMahon is saying is when you do a wet fog, and we know Aerosolver is one non-toxic version of that, and I don't have any ownership stake in Aerosolver, but all that is doing is settling particulates out of the air so you can double HEPA vacuum and damp wipe all those up. That was a trick question.
That was.
Fact or fiction, Dr. Shoemaker is an intense, beautiful, gruff man that demands excellence.
Ooh. Fact to 3 of those.
So what do you think? What do you think people get wrong about Dr. Ritchie Shoemaker?
I think that Dr. Shoemaker holds a very high standard. One of the standards, for instance, is not to make any assumptions, and I think that a lot of medical personnel find that medicine is requires a lot of work to do it right. And if they can cut corners and the like, then they will try to do that. And part of that is making assumptions. And so that's one thing that'll make him upset. Another thing is for him to pour a lot of his life into you and his intellect and train you and whatnot, and then for you to kind of turn your back on him and speak negatively about him and cherry pick like we were talking about earlier.
And really, I would say my experience has been it's even more objective than it's turning your back on objective science and the scientific method.
And I'm not going to name names. I certainly could. And I know names of people that are very prominent. But I think it is probably fair to say that when I came around at late 2009, early 2010, Dr. Shoemaker had already been doing this for 13 years. He had seen a lot of people. And I think it's fair to say, I might be wrong, but that I was really the first person that didn't do that to him.
Mm-hmm.
So,
you're saying, I see. I took that as he had seen thousands of patients already. So he was the most experienced guy.
He was.
Also discovered the biotoxin pathway, also discovered a proven reproducible protocol that could eradicate this illness.
We had 10 biomarkers then.
Yeah.
But there wasn't anybody who was following his system.
Yeah.
As of 2010.
Yeah, that's crazy.
Not one person. And again, I could name names, but I don't care to do that. You know, how many articles have these people published in cumulative?
Yeah.
You know, 5 maybe?
Yep.
Or less?
Yep.
And, you know, we're talking hundreds of people and or thousands of patients. Quite a few of them were practitioners. And so if he seems gruff, he's been hurt by people whose lives he's saved.
Yeah.
Time and time again. Yep. You know, Dr. Shoemaker's not gruff with me, but I don't betray him.
Well, and you've earned his confidence that you're not going to cheat the patient by doing things the easy way or bringing feelings to a differential diagnosis or fudging data or seeing what you want to see. He trusts you as an objective scientist and clinician, you know.
And before I publish anything, I always have him take a look at it and make sure that I haven't made any mistakes or, you know,
and when
that's peer review.
When you do make a mistake, does he put little smiley faces next to it and say,
no,
you were great, here's a participation trophy?
No, he takes a big red marker and yes.
So I have a funny Dr. Shoemaker story. So early on the listserv is this place where basically the Shoemaker certified doctors, remediators, inspectors can get together and share cases and ask questions and talk about, is there any data for that? Or can you send me that paper? And he went off on a question I asked that I knew everyone wanted to ask on the listserv, but no one had the guts to ask because they didn't want to feel the wrath of...
I think I read that.
Yes. And I had on the backside, someone emailed me privately and said, "Are you okay?" And I was like, "Yeah, I'm fine. Why, what's up?" And she was like, "That was so intense." I'm like, "I know. Isn't it amazing that I know what I'm supposed to do with my patient on Monday morning?" And I was scared shitless about failing them and them spending time, money, and energy in my clinic and me not having the equipped knowledge to do my absolute best. That's what I'm scared of. Right. I'm not scared of getting a beat down of you should have read that paper and you don't know this quote or, you know, and that's the part where I think you're right. He might have a little bit of a chip on his shoulder or be burnt out from disappointment. But I also feel like the other story is he still protects the little guy. He still protects the patient. And he knows that if you cut corners, you're wasting the patient's time, money, and energy.
Exactly.
Yeah. So fact or fiction, the truth is a pain in the keister.
Fact.
Yeah. Yeah. Fact or fiction.
Most truths are inconvenient.
Yes.
Because when you know the truth, it requires you become accountable to it. And that's why so few people are interested in what the real truth is. They would rather have their own truth because then they only have to be accountable to themselves. Mm-hmm. If you believe in a real truth or an absolute truth or whatnot, then that makes you accountable to something beyond yourself. Most people don't want to be in that situation.
Initially. But isn't it a deeper relief to the soul and the consciousness once you just surrender to it?
Well, for me, yes. I mean, because I love the truth, and I'm always searching for the truth. Yeah. But for many people, I don't believe they have that same love. It's an easier path. In the same way, it's an easier path to not publish.
Yeah. Sometimes people ask me, like, how do I interview a doctor to know if they're the real deal for CIRS? And what I tell them is, here's two things. Are you in the strict accordance of the Shoemaker protocol? That doesn't mean you can't complement it. That doesn't mean you can't, as we've talked about in prior pods, you can't use herbs, nutraceuticals, Wim Hof breathing to offset inflammation, to get a gallbladder firing, to dampen gas and bloating, to take the edge off brain fog and depression, of course. But so you have to ask the doctor, are you in the strict accordance of the Shoemaker protocol? The second thing I tell them to ask is, do you get dirty with the buildings? Do you get down and dirty with buildings? Do you have your remediators on speed dial? Do you talk to your inspectors that you refer to? Do you go to conferences where environmental professionals and doctors are not hanging out, are hanging out and challenging each other? Are you helping train building professionals on the healthcare side of the building? Right. Are you helping them become so those are my two big things. Are you in the strict accordance of the Shoemaker protocol? And do you really know your buildings? Fact. And if you would have asked me, 25 years ago when I said, I really know what I want to do, 30 years ago, I want to go help people. And 30 years later, I would be up reading on proper installation and flashing of a window for a healthcare issue, I would have told you you're out of your mind. Right. That I would be reading dental journals about 3D cone beams to find hidden abscess on a root canal tooth that doesn't have a nerve anymore and doesn't feel anything. Right.
Learning basic mycology. And what molds make what toxins, and what the water activity preferred for this mold is versus that mold. Who knew?
Last one.
Uh-oh.
As co-founder of CIRSx, Fact or Fiction, you had the desire to keep a conference going so that you can educate others and expose doctors, lawyers, remediators, inspectors, health coaches, patients, public, parents to this illness and a peer-reviewed, reproducible way to eradicate it.
Is there a wrong answer? Fact. Yeah. As it turns out, that the original founding members of CIRSx had been involved with the production of every surviving mold or other mold meetings, annual mold meetings that would attract the people that Dr. Shoemaker attracts. They had been involved in every one of them since 2015. Yeah. And they continue to put those on. CIRSx co-sponsoring with Surviving Mold, and I think the formula works pretty well. I mean, this year's conference in July in Boulder was over the top. Last year's conference, off the shizzle, my nizzle. Oh, I'm not supposed to say that, am I? Okay. My wife is. Never mind. Okay. I actually had a black man staying in my house once, and I said, "Do you mind if I call you my nizzle?" He said, "Yes, I do." I was like, "Okay." That's probably the last time I ever said that word, like 8 years ago. So forgive me. But yeah, the conferences are amazing. Yeah. The conference, and it's not just an opportunity to learn like the best knowledge from the best IEPs and doctors and whatnot in the world, and the most up-to-date information, and learn about the publications that have come out. And I mean, it's not just that. It's the people that come to these meetings are like a family. Mm. Like, I consider you, my brother from another mother. I suppose if you went to Trinidad, you could be a sister from another mister.
For sure.
But we're not going to do that today.
We are in Colorado.
We are. And Yeah. I was going to make a marijuana joke since we're in Colorado, but I won't. Colorado. I like that. That's good.
Can we take those greenbacks from those green tacks and start fixing some school roofs? That's what
Absolutely.
I want to know.
Well, the problem with most schools is they're made as inexpensively as possible.
Yes.
And the cheapest kind of roof to make is a flat roof. And that's the one that's most likely to have a problem. I can't think of my entire career as a student ever being in a building that didn't have a flat roof.
Because having half your school go through CIRS and get on disability and not be able to pay taxes, be productive and creative, saves money, right?
Fact. One of these days, as we attempt to push CIRS into the light, as so that everybody knows about this illness, at some point we'll start treating children when they're 4 and 5 years old. We'll start seeing it, and we'll do the blood work, and we'll identify them, and we'll treat them, and they'll get better just like this.
Boom.
And then we'll make a way for them to go to school and not be in a water damaged building, or we'll make a way for them for their home to become remediated. This illness could be completely eradicated.
I still think we need to start Shoemaker U, and it's all sidewall buildings where kids with that HLA that could ruin your day can go to a clean, safe place.
I like it.
Yeah.
Yeah. No flat roofs.
Yeah. And you could even have construction practices like they have in Europe where you take pride in learning how to build as one of your majors.
Yeah.
Right? We could have environmentally sound building, right? And not just, again, I'm all for saving energy, but when we do all this, LEED certified for carbon footprint exclusively, and you put a flat white roof on the building and then it leaks, there's nothing healthy about that.
That's correct.
Right. So for those of you who want to learn more about CIRSx, CIRSx.com, we're going to be in Frisco, which is outside of Dallas, Texas, in May 2024. Yes. Everybody is invited. Teacher, doctor, lawyer, patient, highbrow academics, PhDs, NDs, MDs, LACs, PAs, NPs, everybody's invited to the dance. But the room will be full of environmental professionals who are very good and dedicated to getting your building clean. Step one, remove patient from biotoxin exposure, and healthcare providers who are not cutting corners and learning, is there any way we can do things quicker, slicker, more cost effective?
Step two,
take your cholestyramine. And this is the legacy of what was originally Mold Congress, which then...
even before that.
Even before that.
The first meeting was in 2013.
What was that
in
called?
San Luis Obispo. And that was put on by Laurie Rossi.
Yeah.
And then after that, Dr. Shoemaker had the first meeting in Maryland the next year in 2014.
I was 2014, yeah.
Exactly.
I was walking down, we had a couple Heinekens. I was still doing gluten, and and we were walking home from that bar, and he said, you need to start doing NeuroQuants. It'll take you 5 minutes to set up with your local imaging center. 80 hours later, in our first 3 failed NeuroQuants, I said, I think I'm initiated.
It was like 3 years for me to get our hospital finally agree that they would do one.
I love how he always understates the homework assignments to greatness. Like 5 minutes. 5 minutes. Yeah. And I will say we are hundreds of NeuroQuants in, and everyone needs to learn about that. Brain image. It's a brain MRI that you then convert to a computer reading your brain that can see early brain volume changes when you can do something about it. Neuroinflammation, neurodegeneration, is like a baseball game, right? It's 9 innings. And man, a traditional brain MRI shows innings 7, 8, and 9. I love when they go age-appropriate atrophy. Right. Like, we expect you to be so gosh darn demented at this point that I can see it with my visual naked human eye. Right? It is so atrophied when they say age-appropriate atrophy. And that morphed into surviving mold, and Paul Taylor and Dr. Shoemaker, who started surviving mold, did a great job. And then they got kind of burnt out on the conference. It kind of peaked with what the one you threw, which was Irvine
in 2016,
where we had Dr. Bredesen, Dr. Shoemaker, and all these greats there. And then, we kept rolling, but then COVID kind of put a damper, and we had to go underground for a couple online conferences. And then the last 2 years, it has been bananas to feel the love and feel the vibe and get renewed on how many people truly want to do things right. And I am grateful that I get friends that I can really grind into the nitty-gritty of mystery chronic illness.
And I see personally two things that happen, and I'm anticipating they will happen in Frisco, Texas, May 16th to 19th. And that is one is I get to see old friends like you and like the IEPs that, I don't get to see that often because we live in different parts of the country, sometimes different parts of the world. I get to see other providers, people I've talked to on the listserv, people that have been in my office or I've been to their place. And so it's like a family reunion.
Yeah.
But the second is that the family continues to grow and you have new people coming in who have never experienced that kind of love before at a medical meeting, and it's medical and environmental meeting, and now legal meeting too, and
for sure.
and they get to be integrated in that and to network into some of the best IEPs in the country and the world, some of the best providers in the country and in the world, and they get to network into that, and that allows them to fast track in their knowledge. So I highly recommend the conference for lawyers who are interested in this, for doctors and other healthcare providers, ancillary care people, indoor environmental people,
joining our
patients.
Community.
Yeah,
think about my classmate Lori Mishler, the Queen of Parkinson's, teaching us so much about Parkinson's, but then her jaw dropping, going, I think some Parkinson's could be CIRS.
Exactly.
And Lori, like Dr. Shoemaker, is a well-published Parkinson's expert who does real peer-reviewed publications, and her whole heart and soul wants to eradicate Parkinson's. And for us to learn from her and then her to go, we need to set up some studies on the intersect between CIRS and neuroinflammatory diseases. It would be cool to be on our deathbeds and say we eradicated some underlying causes of these vicious neuroinflammatory diseases that ruin people's lives.
Caudate nucleus atrophy.
Yeah. Amen for sure. It's fun. It's getting fun. And we need you. So come hang out with CIRSx and learn fact, not fiction.